Hi everyone, my name is Dr. Suzanne Song. I'm a humanitarian child and adult psychiatrist, and I was asked by Dr. Brian Fletcher, who's a friend from medical school, to give a little talk about mental health during the pandemic. So first, if you are feeling irritable, tired, just really exhausted, seem to have a hard time finding energy or interest in anything, know that that is okay, right? That is the norm. You are definitely not alone. Also, if you are having times where you're just finding your stride, you're actually feeling okay, you're finding moments of joy and happiness and you're laughing, that's also okay. There's a large spectrum. So we know that before the pandemic, about 13% of the global burden of disease was due to mental disorders. Right? So currently in the US, studies show that about 40% of Americans are having symptoms of moderate to severe depression and anxiety. Now that's up from about 11% just a year ago. So we know that the pandemic, the protests, the politics, that is all affecting our mental health. And there are a few populations that are more affected than others. So people with pre-existing mental health conditions like depression or anxiety, OCD, PTSD are really struggling. And we also know from current studies that parents are really suffering, especially mothers. People have reason to be struggling, right? There's social isolation, there's loneliness, there's job loss, there's financial stress, worries about contracting COVID for ourselves, for our loved ones. The normal response is to be overwhelmed and to be emotionally drained. It's hard to focus. The area in our brain that helps with memory consolidation is hippocampus. Right now that's bathing in stress hormones like cortisol because it's a lot to have to change our daily lives fairly suddenly with no clear end in sight. But it's not just the virus that's causing the stress. So if we think about a house on fire, like your house on fire, the fire itself would be the virus. But the helplessness comes when the firefighters come to your house, but they're not allowed to put it out. Or they're confused and everyone's disorganized about which hydrant to hook up to. Or they're told they're not allowed to wear their protective gear. The anger comes from when your neighbors are just walking by your house and they see that your house is burning on fire and they don't really care. Or worse, they make fun of you and they just ignore. So the emotional fatigue that we're experiencing is not just all of the deaths and seeing the trauma of COVID itself. It's our response to it at the government level, leadership, and at the community level as well. So early on, when the pandemic first hit, people were scared. We were anxious. There was a lot of uncertainty. We were very confused. And then in the summer, parents especially were really stressed about what's going to happen to their children, especially when we're all working full-time at home, or many people are working full-time at home. How can we take care of our kids full-time also at home when we don't know what's going to happen with schools? Now, kind of mid-fall, people aren't necessarily depressed. We're not necessarily anxious. People kind of have their system, have their routine, kids included. But people are still grieving the loss of life as we know it. Just the freedoms to be able to go out and to smile at people and to give friends and loved ones a hug without worrying if we're going to harm their lives in some way. Many of us are scared of getting sick. Death has come into our lives. Right, so it's maybe seeing it on TV or hearing about the rising number of deaths or just thinking about us getting sick. If you get the flu this year, and let's say you have to go to the doctor and what you'll be exposed to then. Those all have an emotional toll on our well-being. With working full-time at home for many people and also having to take care of your kids at home full-time with remote learning, it's very easy to feel incompetent as a parent and incompetent at your work life. And so that leaves us all emotionally drained. We don't really have our normal ways to cope, and so we're left just feeling that like ennui, that just kind of boredom, and we don't really have much motivation. when you get like this, besides the normal things of going for a walk or eating healthy or texting with a friend or calling someone, remind yourself of who you know yourself to be, because that certainty can mitigate against the harmful effects of all the uncertainty going on around us. So for example, Dr. Brian Fletcher is the person who asked me to do this video, and I know him from medical school. I know him to be extremely funny and also a softie. He has got such a kind, huge heart. That's who I know him to be. For myself, I know myself to be very pragmatic. I tend to be a bit practical. And I also care very deeply about those populations that are invisible, who might not have a voice. So remind yourself of who you know yourself to be. For many people, that's hard because we're just feeling really down about ourselves. Yeah. So for example, I also know that I am a person who is a bit impatient at times. So then think about who you want to be. What do you want to be like? I want to be someone who is more patient. And so you let that be your guiding North Star for your day-to-day whenever you're feeling really, really down. Just ask yourself, who do you know yourself to be? And who do you want to be? How do you want to be in the future? All right, so I hope that's just a helpful few, tips. Feel free to follow me. My Instagram is Dr. Suzanne Song. It's spelled like Susan with a Z. You can also check out my website for more resources. It's suzannesong.com. And on there I have a lot of other interviews and resources on this exact topic. So I've written a few articles for NBC and US News and World Report. I also have an interview on there with NPR's The Takeaway on this exact topic, and a few interviews on our local Channel 5 news in DC around depression and how to engage with loved ones who you feel you might be concerned about with their mental health. So thank you for watching. I'd love to hear from you, and I hope you're doing okay. All right, take care.